What is this dog doing? Well, I'll tell you what he's doing. He's licking his lips, he's biting the air, and then he turns around and here starts licking himself. But what does it mean? I'm Dr. Orion, a veterinarian and a veterinary behavior residency graduate. In this video, you see a behavior that I actually get a lot of people asking me about. And they're usually asking me, is this a normal behavior? Generally speaking, no, it's not a normal behavior, but it doesn't necessarily mean that it's causing any distress to the animal or that it needs to make you crazy worried about what's going on with your dog. Having said that, it doesn't mean you should ignore it. You should try and get a diagnosis before you kind of brush it off. So, as in many odd behaviors, there are usually two big things that can cause it. One would be medical, and the other one would be behavioral. Now, if you see this dog is kind of licking his lips and opening his mouth, do this air snapping behavior, and that can definitely be because of something in the mouth itself. For example, something going on with the teeth or with the gums, some sort of infection or an abscess. So this is something that can definitely be examined and ruled in or ruled out by your primary veterinarian. But that's not the only medical condition that could cause it. Another thing that might cause it would be something like a partial seizure. I'm not going into the reasons for the partial seizures, but you should know that a partial seizure can look like anything. Even this little weird behavior can be a result of a seizure activity. And there are even studies showing that there is a connection between this air snapping to gastrointestinal issues. So, for example, there's some discomfort in the stomach or the intestines, again, for different reasons, but that can cause the dog to show this behavior. I never examined this dog and I don't have his medical records, but I can tell you from what the owner said is that this behavior usually happens at a specific time of the day and it's not random throughout the day. It doesn't seem to be associated with eating or anything like that. If it was because of a medical condition, I would think it would be related to something in the environment or something like a timing wise. Like if it's something in the mouth, then maybe every time after the dog eats, then we see that behavior. Or the same thing about gastrointestinal issues. That maybe after the dog eats or just before the dog is going to eat, then we'll see those behaviors. But it didn't sound like that from what the owner was saying. And also for things like seizures, at least I tend to see them very random throughout the day, but sometimes seizures might actually be caused by something in the environment. So the dog becomes very anxious or the dog becomes very excited, and that will trigger the seizure activity in the brain. So these are some of the medical reasons that can cause it. But of course, behavioral things can also cause it. Otherwise, I wouldn't be doing a video about it. So let me tell you a few behavioral causes. The most obvious one would be something like compulsive disorder. In people, we usually say obsessive compulsive disorder, but in dogs, we don't really know if they obsess over it. So many times we'll say just the compulsive behavior or compulsive disorder. Kind of like in people, even if there is something that triggers the behavior, it doesn't mean that they're in control. Actually, just the opposite. It means that probably the dog can't stop. And that might even affect the quality of life of the dog and of the owners. To treat compulsive disorders, after we actually diagnose them, and for that you need to do a full consultation and to rule out the medical causes, we actually would use some medications with a combination of behavior modification treatment. Remember, there aren't any magic drugs. But let's say it's not a compulsive disorder. What else can it be? Well, one option is what's called a displacement behavior. Displacement behavior is actually a normal behavior, but that happens during times that are inappropriate. In dogs, we will see them lick their lips, maybe start grooming themselves, looking at their genitalia all of a sudden, things like that. It believes to be some sort of coping mechanism, coping with the stress or with the excitement. But I have another option. Maybe it's some sort of learned behavior, some sort of an attention seeking behavior. Sometimes we, the owners, without even noticing, we might reinforce that behavior. We might reward this behavior by giving the pet attention, by laughing, by petting the dog, trying to stop the dog from doing the behavior. And by that, we might be making it worse because the dog learns that, oh, every time I do that, they're gonna give me some loving or some treats or some attention. Each of the options, medical or behavioral, will be treated differently. So, the first thing that you need to do is to go to your veterinarian to rule out all of the medical possibilities. Then, you might need to consider addressing it by going to a veterinary behaviorist or by going to a good reward based trainer. If you know that there is a specific trigger for the behavior, then try to avoid it as much as possible as long as it's not causing even more distress. And if you like this video, don't forget to like it and subscribe, and maybe check out this video too.